Then now let's go from type 1 to type 2 diabetes mellitus. So we talked about insulin dependence. So this is why in type 1 these people depend on insulin from another source. Type 2, this is the non-insulin dependent. So they still produce insulin, but something is going wrong. So they have something called insulin resistance. And this, with insulin resistance, the insulin is still there, but somehow the body becomes less responsive to insulin. And too much insulin can be made, or in type 2 diabetes mellitus, too much insulin ends up being made and secreted into the bloodstream. And this is what we call hyperinsulinemia. So instead of having too little insulin, these people have a lot of insulin, but it's not having the effects that insulin normally has. So how do cells become insulin resistant? So insulin is there, but why isn't it working? There's multiple ways of this actually happening, and this overall thing we call downregulation or desensitization. There are many mechanisms, but I only want you to know what we generally cover in this class at this level. Alright, so what we have here, high blood sugar, and what happens if, you have this blood sugar and all this insulin being cranked out, and the funny thing about your cells and receptors, and this applies to the nervous system as well, if you overstimulate receptors, sometimes your cells and your body will be like, okay, this activity at this receptor is way too high. This is not normal. We shouldn't have high levels of this receptor all the time. Maybe let's turn down the signaling. Maybe it will turn down these receptors. So what you can have sometimes with chronic signaling in these receptors is that, say you have a lot of insulin and you always have insulin signaling turned on, your cells and bodies are like, okay, this shouldn't be on all the time. So maybe we're going to get rid or start to get rid of some of these receptors. So you might see fewer and fewer receptors on cells. And actually, I shouldn't say totally eliminate this, but what we have here, a decrease in receptors. So we still have insulin. Insulin is still there, but now we have fewer receptors. So we can still get glucose transporters appearing on the surface of the cells and absorbing glucose. But if we have fewer receptors than before, and say we have our next rush of blood sugar or glucose coming in, well, we still have insulin, but again, if you don't have enough receptors, this cell right here in this cartoon is just doing all the work because none of the other cells, they've already turned down and downregulated their receptors. So what we have here, the next wave of glucose coming in and even more insulin being secreted. So your beta cells are still there. They're still making insulin, but now this insulin isn't having the same effect as when there were a full cohort of receptors being responsive to the insulin. And this is one cause. This isn't the only mechanism. I gotta make sure that have a little disclaimer here. And yeah, caffeine tolerance. Yes, so the thing is, that's why if you've gone off caffeine for a while, and then have your a cup of coffee, you get super wired. But what if you drink coffee every day? You might be like, it doesn't have the same effect. So this is why it's very similar to what happens in drug resistance or even your nervous system. If you overstimulate receptors, then they kind of turn down the signal over time. So type 2 diabetes mellitus, so they're still producing insulin. Insulin is still in the equation, but something is happening. So one possible mechanism is what we covered with hyperinsulinemia. Sometimes your body ends up doing something to the insulin receptors and pulling them back, and then thus reducing insulin signaling and thus reducing the amount of glucose transporters, thus making it less likely that these glucose, or slowing down the rate of glucose absorption. But another possible cause, and it's actually a lot more complicated, high levels of free fatty acids. So these are, again, lipids in your bloodstream. This is also another possible cause of insulin resistance, of also affecting the receptors. But it's characterized by either insulin receptor downregulation or desensitization. So you're just turning down the signals from the receptors itself. Insulin is still there, but now the body's adjusting the receptors. And again, that critical term hyperinsulinemia. What we have here in insulin or type 1 diabetes is that we have an insulin deficiency, whereas in type 2 diabetes mellitus, we have too much insulin. Now, insulin desensitization, how does that affect the pathway? Well, what happens in desensitization, we still have insulin. Insulin binds to the receptor, and this is the normal signaling. But in desensitization, what happens is that something happens where this signal is turned down, blocked, and there are many mechanisms. Just know that it's affecting the receptor for this class. So if you're blocking these signals, or downregulating or desensitizing these normal signals from the insulin receptors, glucose transporters won't move to the surface of the cells, thus making glucose accumulate in the bloodstream. All right, so then what we have here, this is actually more than, this is why you should know that free fatty acids are involved in desensitization. But again, this is what I had to study at the doctoral level. So again, and actually this is a simpler version, it doesn't even have the phosphorylation sites. But yeah, again, don't study this for this class. Again, desensitization can be summed up as something affecting the insulin receptors. So something is affecting the receptors for insulin. Now, what happens, so in this case with desensitization, how is it different from downregulation? Well, instead of reducing the numbers of receptors themselves, the receptors are there, but something inside the cell is turning these signals off. And that's what I'm getting at here. So if you turn these signals off, you still have insulin binding to the receptors, but now the cells are ignoring these signals. Therefore, only the cells that are still sensitive are going to have the transporters. Therefore, fewer cells are going to have a reduced overall capacity to transport glucose into the cells. So if you reduce this ability, what happens? Well, you're not going to have as much glucose transport out of the bloodstream and into your body. So what we have here is like accumulation of glucose, and we have accumulation of insulin. This is why with type 2 diabetes, what we typically see is hyperglycemia due to having too much glucose, but we also see hyperinsulinemia. So your body is trying to compensate, know something is wrong. And your beta cells know there's too much glucose in your body. That's why they're cranking out the insulin. But downstream, the cells aren't responding to insulin the same.